The CDC estimated that 50% of people with HIV are older than 50 years. The goal is to prioritize on improving the quality of life of long-term survivors and older adults aging with AIDS. My name is Harisha Gajam, and I'm working as a product executive in the marketing department of Hetero Healthcare. On behalf of Hetero Healthcare, I would like to welcome you all to this webinar on HIV and Aging Challenge. We mark more than 25 years of our journey in HIV management. It started with the beginning of manufacturing and exporting of APIs and finished formulations of antiretroviral drugs. Today, Hetero supplies 1/3 of the global requirement of antiretrovirals. Apart from HIV, Hetero was majorly involved in tackling the national emergencies such as swine flu in 2005 or as latest as COVID-19 epidemic. This was possible only due to strong R&D team and state-of-the-art manufacturing facilities.
The HIV is a pandemic that has happened to the humankind and has marked the history. And definitely, it has changed how humans have evolved in the 19th century or 20th century that we get from. There are a lot of issues or historic things that we think that HIV might have evolved from some kind of monkeys or some kind of parts in which the hunters were infected, and then this particular disease has spread all over the world. I cannot take the opportunity to tell you that HIV has gone to even to the smallest of the village of the whole part of the whole world. So that's why truly we can call it a pandemic for a humankind. And definitely this particular issue changed the whole era of the human scientific research in HIV. As we know, HIV came to be known in 1981. And from 1981, we are trying to get past the era of HIV or treat HIV. We had a lot of battles, we had a lot of hurdles, and from them, when we had nothing to treat HIV and see patients how they were dying, to an era now where we can say underlinedly that definitely a HIV positive patient can survive for more than 100 years also, as we have seen people who have aged 202 years and still they are doing well with a background of HIV diagnosis from last 40 years. So there are a lot of things happened in this particular era, and definitely these particular changes have made us understand infectious disease in a new way. As we know, infectious disease is a part in which we are fighting new infections every day. Recently, we were within the COVID-19 era, and definitely everybody has understood that how difficult it is to manage a disease where we cannot know or we do not know the treatment or the part or art of trying to control the infection. When the HIV was known in 1981, it was not diagnosed as there were no good diagnostic tests available at then. Then, when we tried to work up, people only found that the people who were having things like the hippies or they having homosexual partners or people who were having drug addicts, these people were HIV positive. So they were criticized and they were they were taken away or they were partitioned in a different path, and therefore we didn't know that how can we manage the infection. But then when the test evolved, we found out HIV can spread from man to woman or woman to man, and even HIV can spread through blood transfusion. As we know, the story in which a guy who was HIV positive was kept away because he was he was suffering from thalassemia. He was given multiple transfusion of blood, and in this particular era, it was found out that the multiple transfusion could lead to HIV. As we know, HIV initially no treatment available, people who left to die. But when in 1987 they started with a good antiretroviral therapy that were not available at that time, so single drug monotherapy was initiated with the use of zidovudine. From monotherapy, it was found that we could give the medicine to the patient, and this patient, after taking the treatment, definitely would get cured of HIV. But to our response, we found out that HIV itself, after 2 years, records resistance. The virus was smart. It changed its workup, and again, you have a new kind of virus that is growing. So after that, we could find out that there are a lot of cases in which HIV can move on, and therefore, two drug or dual therapy and later triple therapy was introduced, in which we could find out that taking the pills would definitely decrease the number of HIV virus in the blood. Definitely, that can relate to the long-term survival of HIV. Initially, the pill burden was high, the cost of pill was very high, and therefore only few people could afford this kind of heavy therapy. There were no generic drugs, there were no ways in which the poor or needy people could get medicine at a cheaper rate. But from 2000, the era started in which generic manufacturers started to provide drugs at a lower rate. These drugs, when provided at a lower rate, could be given to people living in the most poorest part, like Africa or the Asian era. Now, as we know, the people in areas where testing was low, they couldn't find a good treatment. These people suffered a lot. So there was a catastrophe, and a lot of people died because they didn't get good kind of treatment. So it was thought that HIV is a black death or a death sentence. And anybody who was infected with HIV was not able to survive for long. Their average age at that time was supposed to be only 10 years or 5 years from the diagnosis of the disease. But later, with intervention with the good drug and good protocol of management of the drugs, people could survive more. Initially, there was stigma that was attached with HIV, and therefore, a lot of people had to come forward from the media, film industry, and also the politician to make understand that HIV is not transmittable by touching or cannot be transmitted by simple living or sharing of utensils and things. These common things help us to understand the HIV and the HIV positive people and the infections that harbored in it. Therefore, people who were sabotaged or sidelined due to the stigma of HIV, they could come to treatment. Initially, people couldn't, doctors and medical institutes sidelined the people with HIV as there was no proper treatment available for them. But few people took courage, studied, understood, and then research was done, in an analysis was done, and therefore a lot of people started to get results from the treatment. This treatment was then propagated with guidelines, and then government came up with various ways in which it can provide the treatment to the poorer and the needy people. There were the groups with high risk eras were found out. They were counseled. They were given a lot of time to make understand what the disease is like and how does it spread. In this way, we could stop the spread of the disease and understand that HIV is not transmittable by other reasons other than having unprotected sex with a HIV positive person or sharing of the needles or also doing what do you call also with from the blood transfusion. So these things were studied, worked up, propagated. We had laws in which we had formulation to work up on the blood transfusion laws, in which we would screen 5 diseases like those 5 diseases which would help us to decrease the rate of HIV. Also, promoting blood donation. Secondly, also things were worked up with condom promotion. Condom promotion is one thing that was admissible all over the world, and people were asked to have safe sex. Even people with communities or high risk groups like MSM or casual sex workers. They were find out, they were sanctioned, and they were treated to they know that how they are having the infection or not, and can they transfer the infection to others or not. Lot of agenda by the media had been taken for this. Now, when it comes to the treatment management, lot of doctors volunteered, and initially, after having good session of counseling, people started to treat patients with HIV. Even government programs like NACO, they worked up in a way in which the NACO centers were established, ART was provided free of cost, and people could come ahead and get themselves treated. Initially, people were shy, they were not ready to get take treatment, and therefore people from one place would go to another place, travel there, and take the medications. But good management and proper initiation of the therapy has led to people who can now live well, thrive well, even if they are having HIV. Now, as we see, we have progressed. We are treating the patients with medical elements. Women with HIV positive status can have negative child, or even with a discordant couple, when husband is positive, wife is negative, or wife is positive and husband is negative, they can have negative children also. Even there are ways in which people having interventional, which are undergoing interventional workup like surgeries or otherwise. Now, doctors and healthcare workers are coming forward to treat and manage the people with universal safety precautions. It is the success now that universal safety precautions has been utilized in the long run so that people can take the advantage and get themselves treated. The people who were having lot of problems like kidney disorders in which they need dialysis or otherwise, people doctors have also done lot of transplant workup in which they could help the person to survive. In this particular fashion, we are growing in the medical field, and the role of taking this particular pivot role was taken by the antiretroviral drugs and the generic drug companies or companies who managed to make it in a simple and specified workup so that we can provide a proper treatment to everybody. As we know, treatment is important and treatment works up with lot of research. Research made and new drugs that has been worked up in a regular manner has helped us to update the previous drugs and its side effects. Initially, drugs had a number of issues like high pill burden or a lot of side effects or various kind of drug interaction. But now, as we have grown, as we have passed this particular issue from past 2 to 3 decades, we understand that we can easily manage a patient with HIV. Even the role of post-exposure prophylaxis has also made it important that people who might have had a risk, like Pepsi, that post-exposure prophylaxis by sexual exposure or otherwise, these people can be tracked, can be given good treatment, and therefore we can decrease the amount of burden of HIV from the society. Right now, people are looking out in such a way that they can provide us with a good amount of judgment in which people can live with a single pill of a drug with lower side effects and therefore can extend their uh, life to the longest of the life they can have. Now, initially, we had problems with acute problems of HIV, like there were breathlessness, skin infection, oral thrush, or eye infection, or otherwise GIT infection on all the parts of the body. Right now, we have patients with issues of cardiac issues, renal issues, or neural issues, in which we have to work up in such a way that aging has become a part of the treatment management of HIV. Now, as we know, the aging process as a person grows, he or she can have relative issues in which there are things that have to be taken care of. Not all the time, people go from one part of the age of 50, they can land into diabetes. As we know, some drugs helps the patient to put on a lot of weight, and lack of exercise can lead to diabetes. Diabetes is a multisystem disorder in which lot of part of the body can get infected. We can have diabetic foot complication, we can have cataract complication, we can have a neural infection, skin infection, fungal infection, which are also common with diabetes. Secondly, we can also have cardiac issue in which after the age of 60, 65, people are getting cardiac events, and even people who are not who are on the pills have a greater risk of getting some kind of issues with their vessels, blood vessels, and infections. Now, as we age, people can also have cosmetic issues, and people might also need cosmetic surgeons. So, people with HIV, when we tell them that these particular issues can be faced, they are now, and these particular issues, there are now people or workup places where we can manage the patients. Initially, people were denied or stigmatized for not giving the treatment, but right now, with proper management, with proper mindset, and proper counseling, doctors, institutes, and other people are ready to work up and treat people with HIV. People with HIV need love. People with HIV need good counseling. People with HIV need good plan management so that they can survive and live a healthy life. Healthy, what is healthy life? Healthy life means a person who can work up with a mind, good proper physical health, and also social health. We need to arrange and understand the reasons in which people want to get benefited. This particular benefit can help them to survive well. We want the people should enjoy their life, and for this, good kind of medication, good kind of management, and good kind of treatment plan help them to survive a better life. I understand through this platform, we get the opportunity to let people grab that opportunity. There can be some kind of hindrance in the past, but the future for HIV positive patient is bright. But for that, we should understand the HIV virus is a smart virus. It can change. There are chances of getting resistance or also getting newer kind of side effects in the long run. We need to monitor that. For that, we for this kind of thing, we need to be connected with the HIV physician so that he can guide you in a proper way. Lot of times, lot of small misunderstandings or misconceptions or not taking proper advice lands you in trouble. And therefore, to get a proper advice, we need to understand, read, think, and get the research done. Lot of newer things are coming up. From the pills, 150 pills per day. Now we are going to single pill. In the future, we expect getting the injectables. And from the injectable, maybe which are now to once in a twice, once injection in a 2 months, that we can have in a 6 months or 1 year. The near future, we can have a single injection or pill for 1 year also. So this is how we are progressing, and for this we need to update it. We need to understand, yes, HIV, which was a cruel death sentence in the mid-80s, right now is a lifelong workup or having a healthy life. We can have a good understanding of the treatment management and the disease to live a healthy, happy, long life. So thank you very much from my side.
Yes, sir. So we also have received few questions from patients. So if you allow, can I start with the questions?
Yeah, Rishabh, please.
Okay. So there was a question where it has been stated that when a person is on ART therapy, can he or she transmit the HIV virus to others?
Yes, definitely. Uh, Patient on treatment doesn't mean that the virus is undetectable. The patient can transmit the infection until cannot transmit the infection until the virus is undetectable. So if we check the virus, if it is undetectable, then it is untransmittable. But that does not mean that any person on treatment, under treatment, would not find the test for HIV negative. The test will always be positive. The patient may not transmit right now, but might be there are opportunities when there can be infection. There are various compartments in the body. We have a CSF compartment, we have a blood compartment, and we have seminal or what sexual compartment. And therefore, the virus, HIV virus, can stay in compartments, and we never know if even the blood compartment is lower or low HIV viral load. There can be high in the CSF also. There can be high in the seminal also. So we need to check up for that. So only patient under treatment doesn't rule out the fact that patient won't transmit the infection. Yes, patient can control the infection if it is tested in a proper way, and we can take the risk, calculated risk, when we want to have particular thing like a transplant. If you want to transplant organ from one person to another, so at that time, you can work with the proper guidance. If you want to have what you call marriage, and then we have to have some kind of what you call there is a we want to have some future babies over, etc. Then you will work with proper guidance.
Okay, sir. So there's one more question, like how the aging with HIV affects the person.
Aging with HIV means a normal person ages, everybody ages. Initially, in the initial era of HIV, when the ART tablets, ART was limited, people could not survive more. They were the age limit for they was 10 years or 15 years of that. Right now, we have variation in the ART. We have good ART with lower side effects. This ART, when taken properly, a person on an average, a human being used for 100 years. So we can say a person using 80 years, 90 years, 100 years is a long-term survivor. Long-term survivor can have to face some kind of challenges. The challenges can be challenges of the heart, challenges of the kidney, challenges of the eyes, brain, etc., which are chronic disorders, not acute disorders. So long-term survivors are people who have passed the age of 60 years, 50 years, and they are doing well. In my clinic, I have patients who are 93 years old, 89 years old, 67 years couple is there. So these people have crossed their age, 60, 65, 70, but they are doing healthy with the antiretroviral therapy management.
Okay, sir. And one more question, sir. How long he or she need to take the medicines of ART?
Right now, the treatment management for HIV is a daily dose of a drug, and we have to continue it for a longer time. As we know, HIV doesn't have a cure as such per se. What we have is a functional cure with the help of the ART. So for that, we have to continue the medication, and the aim of the medication is keep the virus low enough that the machinery cannot diagnose or detect them. So if we keep the virus low, it will not propagate. And if it will not propagate, then definitely we won't have any loss of CD4 count, and we will have a good immunity power. Having good immunity power, person can live. It's not heavy. He can survive.
Okay, sir. Also, one more question, sir. Can a person take break from HIV medicine?
HIV medicine break is a concept that was there previously when the pill burden was very high. So the pill burden, when there were 150 pills per day, 100 pills per day, at that time were difficult to face. When they, at that time, a concept was involved for cutting down the medication for Saturday, Sunday. So these kind of things were there. But right now, as the pill burden has come to a single pill, even the size of pill has decreased to a smaller size. It doesn't have that much impact of not taking a pill. Previously, the pills have a lot of side effects which leading to changes in the body structure. There were obesity, there were buffalo humps, there kind of changes in the body structure also. But right now, the pills what we have, they do not have any kind of changes in the body structure. So that is not of any advice of talking about. We are going towards injectables. injectables that we have right now, they are given once in a 2 months. So that can happen, but due to cost issues and other social issues, might be they are not available in India right now. In the future, we are planning that we can have the dose.
Okay, sir. One more question. How can one deal with extreme fatigue?
How can one deal with extreme fatigue?
Fatigue.
Okay. Extreme fatigue happens when the muscles or the body cannot get a good kind of oxygen or healthy when we have more of lactic acid in the body, if the muscles or body is not getting proper rest, then definitely we are having fatigue. So fatigue can come due to lack of sleep. Fatigue can come due to lack of micro vitamins and elements. Also, fatigue can be there due to lack of exercise. So if we have a good routine, if we sleep early, wake up early, and if we have good exercise, definitely we will get less of fatigue. And still, if a person is having some kind of fatigue other than that, then they should get evaluated from the physician.
Okay, sir. One more question. Are there any chances of cure in future?
Yeah, definitely. We are growing in a way in which we are having a chances of cure from the day one of HIV. We are promised, and every day, lot of money is being invested every day all over the world just to get rid of this particular disease. But still, we have not got any of thing that has been that can be said that it will accumulate to a total cure of HIV. We have few cases, 2 or 3 people who were cured of the HIV virus, but they couldn't survive more. But we are still in research, and maybe in the near future, we will have a cure for HIV.
Okay, sir. One more question. Sir, I am positive and my wife is not. Should I disclose it to her? I fear being abandoned.
I think we should definitely share the element to the wife, because it is a right of the partner to know what kind of infection we are harboring. We, as a HIV physician, always advise that we should not have HIV for the future generation. So there are a lot of couples where the husband is positive, wife is negative, and 90% of the time, only one single partner comes as a HIV positive. In my lifetime of last 2 decades, I have disclosed everything to my patients. I have never seen the wife or husband who has separated due to the HIV status. But this should be done with proper counseling and proper understanding, because HIV is not transmittable if it is undetectable.
Okay, sir. One more question. Is there any medical support for HIV patients?
Medical support in what means, like my financial support or what?
Insurance kind of, sir.
Insurance kind of support. Government gives pre-ART, so that's why medical insurance. Till now, we have not got any such kind of things from there. But we are in a talk with these medical insurance companies via the government. The parliamentary forum of AIDS Society of India is working on it so that we can have insurance for the people. But still date, we have not got that particular issue solved.
Okay, sir. One more question. So for international travel, do I have to reveal HIV status, as I may have to carry medicines? Will my visa be affected?
No, not really. A lot of the countries do not ask this particular thing. And when a lot of people have traveled in the international World Cup, only thing you have to carry your medications with proper prescriptions, and you're not judged for HIV. No need to reveal the status for HIV to anywhere until unless asked. Specifically.
Okay, sir. Is like, what are the long-term toxicities of the medications?
Long-term toxicities depend on the medication what we use. There can be renal toxicity, there can be hepatotoxicity, there can be issues like pigmentation of skin, weight gain, leading to diabetes and other kind of metabolic disorders. So long-term treatment management requires proper management with routine monitoring. So monitoring of the health with the different organs will help us to understand how the work is going on. And it's a long-term disease, chronic disease. So you need to be connected with the doctor so that he can guide you in a way in which we can control the long-term side effects.
Okay, so one more question. Which is the best regimen you prefer in your patients?
The best regimen is the best what the patient needs. So best regimen always depend on the patient. It is specific. We cannot just dial up one particular regimen for everybody. Right now, we have the latest medications with single pill with low side effects. So we prefer that to our patients.
Okay, sir. Is there a need of change of therapy with aging?
Yes, definitely. Uh, Change of therapy is there as per the individual, as per the CD4 virological and immunological response of the patient. Whatever we have right now, we have the best regimen right now, and this regimen can be used for long term. The reason why there are lesser side effects, lesser changes, and people can have them without having to go changes in the metabolic work of the body. So we can continue the same.
Okay, so last question for this webinar is, what is the role of nutrition and the nutritional supplements in managing HIV?
The role of nutrition depends upon the geographical area a person lives in. The person who is having a diet as per this area, we should work up of giving a high protein diet. A high protein diet should also be economical so that the person can take it in a daily run. So what I prefer asking a patient if he's a non-vegetarian, he can go for boiled eggs. Boiled eggs not cost more than 5 rupees per workup, and this can be taken every day. Secondly, boiled eggs are covered; they don't get infected, and also patients who are vegetarian, they can have high milk, and also they can have tofu or paneer in their diet as frequently as they can manage. I also advise to take people fruits because micronutrients also help them to have a better gut flora, and they can then work out well.